If you don't feel comfortable, I should say, working on anybody, back off. If someone has never had a lesson before, you really do not want to stimulate anything if they're pregnant from the bra on down. I don't want to stimulate a sort of a dilation or anything like that, especially too, she's about to travel and so forth. But again, she said, now if she would have told me she was like 6 to 7 months pregnant and I knew she was about to fly out of here, I'd back off. You know what I mean? Because again, she's got a flight to Australia, these kind of things, she's going to be moving luggage. I really do not need her excited or dilated. But she's been worked on all week, she's familiar with the touch, you know, because if you've never had my touch and I give you an hour lesson, you're drooling. I mean, like, you're just, you know, it is not a bad experience. So, and so again, that kind of excitement, it's not sexual in any way, but it's still enough to relax someone enough. Again, I don't want the pelvic floor to open to that extent. That being said, sometimes too with this, I come over the table. Now I want her comfort to be here. Now men don't have this issue, women have a uterus. Okay, so when a uterus expands to have a child, what happens if it's not integrated at all, and this is where women I think have a lot of, I wouldn't say post-operative trauma, that really comes I think more so from the C-section because they knock you out, you wake up, okay, 1 minute I was pregnant, I'm not, you know what I mean, it's a lot of, you know, change in body mass weight and it happens, not to say that you don't deliver vaginally and you have those issues, but I think the more medical is around the child in the delivery, it helps, or doesn't help, I should say, with the bonding process. Now, the uterus will expand all the way up. Sometimes it'll feel like it's in your esophagus, depending on, God forbid there's twins or triplets, I don't, you know, because it's just everywhere. And then you also have bedridden. So what I look to do is, so then after you give birth to it, the uterus isn't integrated, we tend to say, oh, this is heavy. Like it's a third person, you know what I mean? We don't integrate it back into the, like, this is me. So I know I'm heavy, not my belly is a separate. So I'm gonna come underneath, just find where the womb is in her system. Now with this, I am a bit more hand over hand because again, it's sort of like I'm taking the whole womb. And what I'm doing here is just a light rotation, but I'm looking, now she wants to go out with that belly, but what I'm looking to do here is I want to bring it sort of back into her, right? So that's my intentions of coming into the back and let her, again, feel how she can really use that abdomen within the pubic symphysis. So now, if you notice where my elbow is, this is going to be key. Because what I can do here, very similar to what we did in standing, look at what I can do now to widen her and come in here. Now, if you have to come around the back, come around, I would say, the bra line area, upper thorax, mid-thorax, but I'm not, again, working in the lower part of her back. Look how gentle I am. So I really have to find a comfortable spot because at some point I'm going to fatigue. And that's the one thing I don't show you at all because I'm always seating or protecting myself that I don't fatigue. I go, 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 go. You really rarely ever see me tired. And if I'm tired, usually because I have some crap going on at home or something like that that's getting me more so than work. Or some of my kids are in the hospital and stuff. Again, this is where I'm vibrant, I'm funny, I'm chatty. I have people that go in the hospital, I have people that don't make it. I have people that are, you know what I mean? I don't worry about you. I know Max is gonna go home and get fed right now or whatever. I don't worry like that, but if I know there's a concern for his health, then yes, I take that home with me. So I try and keep my life light, but if you sit there every day for every client going, oh my God, that kid's not getting the right nutrition, and I hope they went to the gastro, you can't. The door closes, bye-bye. You really have to, So see how very similar she's responding like Jagna did. Now normally, I would move her in a way that her head would be stable. Right? But again, what I'm doing here is really working with that uterus in all facets to integrate it back into the belly. And so you will see a bit more when I'm doing this kind of work with the abdomen where the head is going away, and that's okay. Does that make sense to everybody?
I don't understand very well. Yes. What the beginning of this lesson? What want me to teach her like a pregnant woman?
I'm not so much teaching her movement, I'm bringing it where the uterus is acting as if it's an organ within the body, right? That uterus can expand, but also depending on how the baby is taken, can expand this way, can expand this way, can expand this way, can do all of the above, right? So, but it tends to, in the body, act like it's a separate bubble. So you lie down and it's sort of like the baby's laying on top of you, right? So what I'm doing here is I'm going around my mental uterus, right? And it might just be her belly shape. And I'm just going in and I'm allowing her back to move, her vertebrae to move, but letting that uterus come back into her system. But like I said, normally I would have head stabilize and do this, but see, now I'm looking for the spine to torque. That's not necessarily my intent. What I'm doing here is working on her buoyancy and her integration. Now right here, her belly's heavy. So I'm changing my lesson a little bit. So now this is very similar, like working under the head, except I'm reversed because I'm protecting her. But I'm doing here, and what I'm doing now is lightly lifting her belly, and then putting it back down again. Because that's another thing. She does not know how to put her belly down to the table. Most of us don't know how to put our back or our butts to the table. Imagine now all of a sudden you're pregnant. How do you put your uterus to the table?
Babies don't enjoy it, I think, this kind of touching movement.
And you always want to check in with your client to make sure they are okay. A lot of clients, because they think you know what you're doing, which hopefully you do, but I'm very good with pain. No, on my table there's no pain, there's no discomfort, whatever is your mental image. Now I'm going to come a little bit this way. Again, look at how I'm widening her out and doing a light lift. Synchronizing all as much as I can with the pelvis with the uterus.
We're getting closer to the spine. It's like one unit.
Yeah. Now another thing that you can do, I can saw it right here. Okay, that's good. Egg, yes.
Is there any rotation done with your left hand as well?
Well, right now I'm working on, again, there'll be some rotation where more so that she's coming away like this. It's a very limited rotation. I'm not looking for walking right now. Right now I'm just looking to see what I can do to bring that uterus into the system. Right? Instead of being like, oh, I just ate that meal. Like the meal is separate from the body. So what I'm doing here now is an egg ball in the back. Just to give her a little bit, now that she's, quote, getting looser, more comfortable, whatever you want to say, that she's not just flopping back and coming over. Because
That feeling you're gonna fall.
Right. Alizé's here.
No, not sad.
Oh, really?
Yeah.
Oh, boy, they can get married. Because she does this whole, la, like a sing-song loud.
Very noisy.
Does that make sense to everybody? Mm-hmm. Now, I did not do both sides of her. That being said, you are pregnant. So I want you to get up and go around. If at break time I need to balance you out, please do not hesitate. Okay? Because I will balance you out. Yep. So, because I don't want a lopsided pregnant woman going home. But again, what she should feel now, okay, just also buoyancy-wise, a belly should go down as you go up, especially if you're pregnant. So what happens lots of times, you'll see people that are like this, because the belly wants to go
And
up.
there is no rotation in the womb.
Right. So the difference when they're walking like this, right, when they're pregnant, versus, again, walking like that. So that's, again, also what I'm looking for when she gets up, that her belly can have its own place now and feel better in standing, versus, again,
Not always lift
right,
something.
right. But when you get pregnant, especially when it happens fast, again, you get that almost like your stomach's falling. And you want to like pick it up. If you notice like Meghan Markle, I don't know if she's doing it for cameras, she gets very defensive, but I've never seen a pregnant person from the beginning that was like, you know. And people look at it like she's being like, oh, I'm pregnant, but I think it's much more protective. But I still think either there's twins in there, that's a big baby coming out, and she's tiny, and I don't know, I think it's a C-section. So,
Excuse me, but if you are pregnant with twins or maybe 4,
correct.
So, what is the best position?
Not to touch if it's so big.
Not with your husband anymore.
Yeah, but
After quadruplets, forget it. I'd be like, it's been nice knowing you.
for me, it's good that I not always understand what you are speaking.
It's American.
Sorry, Betty.
It's American and English. I am not
It's
always
humor.
catch everything.
Yeah.
Yeah. So the woman is very big. One.
You don't want it to get to that point without some kind of integration, because again, with quads in there, and especially probably what they're looking at bed rest, so we're dealing with those kind of things. If you know that there's twins or multiples,
Yeah.
I would offer this kind of lesson as soon as possible, because again, you want the muscles of the stomach to be able to integrate all of that. Right? Like I can move my whole belly, which includes my uterus around, right? Whereas again, if that gets detached, and you see it more with IVF, and this is one of the things that
What
was
is
work.
IVF?
IVF, in vitro fertilization.
Oh yeah.
When they put the embryo on for an IVF, right, they do it and it's more the weakest part of the wall. So most IVFs go for a C-section because the uterus wall is weak, but also the baby attaches on an exterior versus an interior. So again, on an IVF baby, they tend to be a bit heavier because they're attached from the front, from where the doctors are at. So that's another thing to consider.
So they're always attached in the front?
For the most part, they go for where the wall will attach, and it's usually the weakest part of the wall. So since that's where the placenta ends up developing, it ends up in a C-section because they're too afraid the wall's gonna be too weak. So Professor Wu was really excited that I was up on my uterus integration.
No, but if Ilona's...
How does that feel, okay?
Yeah, I feel more inside.
Yeah, yeah. And hopefully too, your breathing has a bit more room.
Yes, that's for the I can't feel easy.
So when she's lifting up now stuff, again, see where the stomach and uterus can integrate versus here, again, that inflection and being like,
Yeah, I remember from my
Yeah.
pregnancy, I couldn't breathe. It was like,
yeah, yeah. Does that make more sense with your question? Did I answer it?
No, I am sorry that I didn't know it earlier.
Oh, I know. I wish I knew me a lot earlier.
A lot of problems.